So here we are at ASH Congress 2017. I just came from one of the sessions that discussed the DUO clinical trial, which is a clinical trial of duvelisib compared to ofatumumab in patients with relapsed refractory chronic lymphocytic leukemia. I think that what has been interesting through much of the Congress in general is that we're looking at a lot of second generation, so to speak, or different PI3 kinase inhibitors and BTK inhibitors. So these are sort of second generation molecules that are hoping to improve upon the safety profile of the two that have already been approved. So that being ibrutinib and idelalisib, which was a PI3 kinase inhibitor. Duvelisib is another PI3 kinase inhibitor that is delta and gamma. So this was a study looking at that agent versus ofatumumab in relapsed refractory CLL patients. Clearly they did meet their endpoint of the study. The PFS was higher with duvelisib versus ofatumumab, but I think the PFS was short, or we expected maybe a little bit longer progression-free survival. So when we talk about how is this going to be used in the context of everything that's going on for CLL, I think that certainly we're happy to have other agents, particularly if they may have less toxicity. So we need longer-term follow-up of duvelisib when we start looking at other PI3 kinase inhibitors. And it's always nice to have additional drugs in our armamentarium, because ibrutinib has been, let's say, the most widely used BTK inhibitor that has now made its way in frontline. So as patients relapse off ibrutinib, it is always good to have other agents to use in relapse refractory CLL patients. Now, of course, we certainly have a lot of agents to choose from, so I think in the grand scheme of things, there's going to be a lot of different agents or combinations of therapies that we're all looking at after patients fail ibrutinib, or if they're using ibrutinib in combination with other agents. So duvelisib may represent one additional drug that you can consider for your relapsed refractory patients with chronic lymphocytic leukemia.